you've talked about the success rate, about 70%, I think you said. Kerry's asked about the rate of recurrence after people have completed a course of treatment.
Yeah, it's a very good question. So what we tend to encourage people to do, and again, this is coming kind of through just liaising with lots of clinics throughout the country and even abroad. If patients finish a successful course of sessions, I think the first year is the critical time period to get them through. And we encourage them, they don't all have it, but we encourage them to do like a infrequent top-up session. Starts off with once a month and then maybe stretches out to once every 2 months. I try and encourage all the patients to do that for the first 12 months. If they get through that 12 months, they usually want to carry on doing that, and the frequency, again, I normally suggest them is every 2 or 3 months. Of the patients we have done that with, I can honestly say we haven't had any that have relapsed. Now, the patients that we who don't have that, let's just say who had their course, they go away, there's a percentage of them who we do see again, and it often is around the 12 months mark that they will tend to relapse. That's not to say that if they don't have their top-ups, they will definitely relapse, because that's equally not the case. I've had patients whom I haven't seen for a few years, and I catch up with them and how are you?
It's the way with all therapy, isn't it?
Like everything, and they haven't done my recommendations, they haven't had the top-ups, but they're still fine. So I can't.
So those ones who relapsed after a year, did they then have to go through the full course of 20 sessions again, or is it likely to be fewer?
Well, from ones I can recall, generally not. No, you tend to find them, like a stunted course of sessions will then usually get them back to where they were, thankfully.
Yeah.
But yeah, I mean, for that reason, I just think to them, I try and encourage them to do it just to try and stay as good as they can be, really.